Hey, what is up everybody, Matt here, and this is going to be a very exciting video because we are going to be looking at the before and after results of using oral minoxidil for treating hair loss and faster hair regrowth. I have to warn you though, because some of these results I'm going to show you in a moment are going to be pretty dramatic, so please do not use this video to self-medicate yourself with oral minoxidil, but rather consult an appropriate physician who could better assess your suitability or non-suitability for this medication. Now let's start with the video.
This video is brought to you by GoFiber Hair Building Fibers. Pick up your free sample and get instant hair confidence. Start your transformation today.
Hey, welcome back everybody, Matt here, and you are watching my hair loss and hair transplant related channel. If you are new, make sure you subscribe and more importantly, watch my last video on oral minoxidil where I was talking about the pros and cons of using oral minoxidil in conjunction with androgenic alopecia. So you may want to check it out first. It's just a 5-minute long video. It's not going to waste a lot of your time and it's really on point. Now, in this video, I'm going to only talk about the before and after results of using oral minoxidil. I chose 4 different cases, 1 female case and 3 male cases. There are going to be different responses based on whether it was a female or male. There are going to be different hair regrowth responses based on the area, being the mid-scalp crown area and frontal third, and also based on the dosage used. Before I start with the case number 1, I just want to tell you that these are all clinical results. That means they were properly observed and assessed by a physician or medical professional. No random forum results or some Reddit results of some random guys where you don't even know whether they're real or not, whether the person have used only minoxidil or maybe the person has also used some other treatments in conjunction with oral minoxidil. So that's a little disclaimer, and now let's start with the case number 1. Let's take a look at a 28-year-old female who has been using 1 milligram of oral minoxidil for 6 months, and you can clearly see how the thinning line all across the mid-scalp is kind of closing up nicely after the 6-month mark, and we clearly see how the hair is thickening. What this study confirmed was also that similar results in terms of efficacy and tolerance were already observed by combining only 0.25 milligram of oral minoxidil and 25 milligrams of spironolactone for treating androgenic alopecia in females. And here is the study for that on 100 women. So if you are a female watching this video, the efficacious dose of minoxidil oral can already start at 0.25 milligram per day. Okay, now gentlemen, let's start with 3 more cases which are about 3 males. The case number 2 is a 32-year-old male who has been using oral minoxidil 0.25 milligrams only for 6 months, and he was a part of a larger study. You can check out the study in the description below. Now, the good thing about the study is that it did not only provide us with the clinical before and after photos, but also the trichoscopic before and afters, where we can clearly see whether the hair shafts got thicker or not. Now, in fact, they actually statistically did not get much thicker for the whole group on average, okay? Statistical trend towards better response from 0.25 milligram oral minoxidil was only detected for patients with mild or moderate androgenic alopecia. That means that as long as you have mild or moderate androgenic alopecia, 0.25 milligram of oral minoxidil could potentially work for you as a man, but once you have already experienced some major shedding, you have already thinned out quite a lot, you have to increase the dose on 2.5 potentially to 5 milligram of oral minoxidil per day, and this is where the magic happens. The clinically documented case number 3 will be 28-year-old male who has been using 5 milligram oral minoxidil for only 3 months, and you can see his crown area, and there is a clear difference. As you can see, over this 3-month period, this patient hasn't been using any other anti-hair loss treatments but oral minoxidil 5 milligram. Another study also found out that oral minoxidil significantly increased the total hair count at the vertex, and more specifically the increase was from 26 hairs per square centimeter onto 35 5 hairs per square centimeter. And the fourth case, it's going to be the most amazing case, but it's not going to be only because of minoxidil, but also 0.5 milligram of dutasteride. So here you are looking at a patient who is 30-year-old, and after 4 months of using 5 milligram of oral minoxidil and 0.5 milligram of dutasteride, you can see how his frontal third and even hairline got much thicker, and his hair literally regrew on his temples as well. So this is pretty remarkable, and again, it's only 4 months, so probably after 6 to 12 months the regrowth would have been even much better. Furthermore, this last study also compared the side effect profile of 2.5 to 5 milligram oral minoxidil versus 0.25 milligram oral minoxidil, and they realized that the side effect profile is not that different. In fact, the hypertrichosis, excessive body hair growth, has been observed by 24.3% of participants using 2.5 to 5 milligram of oral minoxidil, and swelling has been observed by almost 5%. And if you take a look at the group using 0.25 milligrams of oral minoxidil, the hypertrichosis has been observed by 20%, and swelling by 4%. So it doesn't differ that much. In the last episode, which is going to be coming on the topic of oral minoxidil, it's going to be also very interesting because we're going to be looking at some responses of doctors and physicians who have been prescribing oral minoxidil for many years to their patients, and what they have to say about their experience, side effect profile, efficacy, and so on. That was it for this video. Let me know how you liked it. Again, comment below how you liked the results. That was me, Matt Dominance from the Hair Transplant channel. You can also sign up for a consultation with me on mattdominance.com/mentoring, where I'm going to help you out find a reliable hair transplant doctor, no matter where you are in your hair transplant research, be it at the beginning, be it somewhere in the middle, evaluating some quotes or alternatives that you have, some different doctors that you have already selected for your potential hair transplant. Let me help you with that. I can guide you. I can give you some value on that for sure. Thank you so much for watching, guys, and I will see you in the episode number 3 on oral minoxidil. Take care.